Over the last several decades, reconstruction of various wounds in the head and neck has undergone a tremendous evolution. I'm Dr. Sameep Kadakia, Director of the Comprehensive Head and Neck Oncology and Reconstructive Plastic Surgery Program here at Premier Health in Dayton, Ohio. Today, I would like to talk with you about the advances in head and neck reconstruction, specifically free tissue reconstruction. You may also hear this called microvascular reconstruction or free flap reconstruction. I completely understand that these words can be quite daunting to hear and challenging to understand. I hope that after this video, while it will not replace the conversation that we will have in person, you will have just a little bit more information to help you understand what this incredible technique involves. Many years ago, prior to the advent of free tissue reconstruction, patients who were undergoing cancer surgery of the head and neck, or trauma surgery for that matter, were left with significant wounds that impacted their quality of life substantially. Not only this, but the limited ability to repair wounds also impacted our ability to remove various tumors. As time progressed, the concept of free tissue reconstruction, or free flap reconstruction as we say, was pioneered. What this process entails is taking either skin, muscle, bone, or a combination of all of the above from one part of the body and transplanting it to the head and neck region to rebuild what was lost through an injury or intentionally removed from cancer surgery. This also applies to patients with various wounds and/or wound healing issues that may have ensued from other reasons as well. During this tissue transplant, the tissue that is desired is taken from a different body site in a safe manner, along with several blood vessels that ordinarily would keep that tissue healthy. That tissue is then moved to the head and neck region, where it is used to recreate and resurface various wounds while hooking up those blood vessels to a different set of blood vessels from the neck. For example, if the patient has jaw cancer and a small portion of the jaw needs to be removed, we are now able to rebuild the jaw. One of the best places to get bone to rebuild the jaw comes from the fibula bone in the lower leg. The fibula bone is usually kept healthy by receiving blood from various vessels that travel through the thigh and the leg. In order to keep the bone healthy after transplanting it to the jaw, those blood vessels have to be hooked up to different vessels in the neck in order to give that bone a nice healthy supply of nutrients. Amazingly, removing the fibula bone from the leg generally results in no long-term problems for the patient as far as walking is concerned, because the fibula bone is not critical in weight bearing. In a similar fashion, we can use skin from the forearm to rebuild wounds of the tongue without any long-term functional consequence. As a community, as we have gained more and more information about the human body, we have been able to use skin and muscle from the thigh, the back, the abdomen, and many different sites to improve the functional rehabilitation of patients after having major surgery. This not only allows us to be more thorough in the removal of cancers, but it also allows us to offer patients the very best chance at an excellent functional recovery as well. It is important to note that not all patients will be suitable for this technique, and a thorough study of the history and testing will be performed prior. Of course, your surgeon will have a detailed conversation with you about this process, should it be applicable to your personal situation. The success rates of free tissue reconstruction in the United States generally range from 90 to 95%. Your surgeon will speak with you about the risks and benefits of this technique and its limitations as well. While surgery is generally successful, there may be times when patients' bodies may form blood clots or infections that may require us to try backup options, go back to the operating room to fix these grafts, or try entirely different processes should the first option not work very well. In a similar light, while the risk of complication to the area where the flap is being taken from are generally minimal and very well tolerated, there certainly may be some patients who have a wound healing issue or some change in functionality. Although this procedure represents the gold standard for reconstruction in many parts of the world, we try our very best to be transparent with our patients about the very best outcomes, as well as the possibility of challenging ones as well. At Premier Health, we strive to build a relationship with our patients based on honesty, integrity, the desire for the very best outcome, and an exceptional patient experience. Free tissue reconstruction has truly revolutionized the way that we perform cancer surgery, and we are pleased to offer it with high volume, proficiency, and great success here at Premier Health.